So guys, today I want to talk about Champagne Full Facial Rejuvenation. This is my customized approach to each individual patient. Let's say a patient comes into my office and they are concerned about facial aging. As the expert, I need to evaluate what is happening to their face that is causing them to see certain things that they want to address. So I start top to bottom and investigate the brow, for example. Is the brow drooping? Are the eyelids drooping? Is there extra or excess skin of the upper eyelids or the lower eyelids? Is there bulging of the lower eyelids? Is the midface dropping? That's this portion of the face here. Are the corners of the mouth dropping? Is the lip elongating? Lower face, are there jowls? Those areas here that start to sag on the bottom of the mandibular body or the jaw line. Is there excess skin or that neck waddle underneath the chin here? So those are all things that I have to evaluate if I'm going to allow my patient to achieve full facial rejuvenation. Depending on ages, some patients may only need a few areas addressed. Late 30s, early 40s, maybe just the upper face. Those are the areas that we start to see first. Maybe the upper eyelids or a little drop in the brow. As we progress into our later 40s, early 50s, we may start noticing areas around the lower face or the neck. In the 50s and 60s, certainly by then, brow, eyelids, lower face, and neck may all be included. So there will be various procedures that I'll recommend for each individual patient. So let's say my patient would benefit from a brow lift, and a brow lift would address ptosis, which is drooping of the brow, the heaviness in the brow area. A lot of patients recognize that in the mirror as sort of heavy hooding of the eyelids and just looking a little less refreshed, maybe tired in appearance. The way I address that is through an endoscopic brow lift. And what that is, it's a surgical procedure where I make small incisions in the hairline, one in the middle of the hairline here and one above each eye, and then one incision in each temple. All of these are behind the hair and hidden in the hair so that there's no evidence of surgery. The endoscopic brow lift approach allows me to use a small camera that I enter into those incisions and lift the brow all the way down to the upper border of the orbit or the eye socket. I release the tissues across the brow and then elevate the brow upward and outward. Some patients request just what we call a lateral brow lift. Maybe these are younger patients in their later 30s, early 40s, and just need a little bit of a lift of the corner or the tail of the brow. And so that approach mostly focuses on the sides of the brow in just lifting the brow up and out like this. The procedure itself requires use of dissolvable anchoring devices that when I lift the brow, I anchor the brow to those devices, and those dissolve after 4 to 6 months. Little tiny incisions are closed with suture or surgical clips that are removed after about a week, and downtime is somewhere around 10 to 14 days. Mild to moderate bruising and swelling of the upper forehead. So let's say my patient comes in and they have concerns for sagging skin of their upper eyelids, or they just have a tired appearance, but they're not sure what's going on. I evaluate the upper and lower eyelids, and during my Champagne Full Facial Rejuvenation procedures, I can also include upper and lower blepharoplasty. These procedures remove extra skin and potentially excess fat around the eyes. The incision for the upper eyelid is made right in the natural crease, so there's no evidence of any scar after the procedure. Downtime for these procedures would be in the range of about 10 to 14 days. Tiny sutures in that natural crease are removed after about 5 days. Minimal bruising and swelling, and it really helps to rejuvenate that portion of the face to open up the eyes and allow you to be more refreshed. It can also get rid of the lower bags under the eyes, and sometimes those dark circles can be addressed as well. So some patients come in and they have volume loss in this portion of the face, maybe drooping or flattening. This area is addressed best by performing what's called a mid-face lift. This procedure addresses this portion of the face and lifts the tissues back up and out to a position where they would have been when you were younger. The approach for this procedure is 2 small incisions, one on each side, up underneath the lip,
And that allows me access to the tissues of the midface here with no external incisions. So there's no scarring on the face from this procedure. The procedure itself requires a little dissolvable device that's placed below the tissues that helps to elevate the tissue up and out. And it's anchored up in the temple in this region. So there's a small incision up behind the hairline here. This procedure effectively lifts the face up, gives back volume to those areas where it has dropped over time, and helps to improve the contours of the face, especially from the front and side views. This procedure downtime is maybe somewhere on the average of 2 weeks. Initially, there can be significant swelling in the face that resolves over the first 1 to 2 weeks. And I always counsel my patients that it does take a little bit of time for the edema in the midface to come down to the appropriate amount that doesn't look overdone. And in the end, results can last a good 5 to 7 years or beyond. The upper lip can elongate as we age. And so that portion of the upper lip between the bottom of the nose and the pink portion of the lip, and that can be addressed with a central lip lift. A central lip lift is where I make an incision right underneath the nose in a loop type pattern. We call it a bullhorn incision. Then I create that same incision below the nose, somewhere in the range of 4 or 5 millimeters, maybe a little bit more depending on the length of the upper lip at the time. And I effectively can remove approximately a third of the upper lip in through that incision to lift the lip up and out. It helps to improve the view of the Cupid's bow and shows more of that pink lip. Downtime for this procedure, maybe 7 to 10 days. The incision heals after approximately 5 to 7 days, and we remove the sutures at that point. That procedure should easily improve your smile, improve the appearance of the lower portion of the face and around the mouth for at least 10 to 15 years. And lastly, let's talk about the neck. Many patients start to see the area underneath the chin droop over time, and it's a very problematic area for a lot of people. So to address the neck as part of the Champagne full facial rejuvenation procedure, I typically combine that with the facelift. The reason being is because things sagging in the face and the neck tend to happen at the same time. We also address those areas through the same incision. The incision that goes around the ear for the facelift also allows me access to the area of the neck that needs to be rejuvenated, which effectively pulls the skin tighter, but not over tighten. My goal is to have a refreshed look, but not an overly done look. And all incisions are hidden in all of the natural creases around the ear so that in the end, there's no evidence that any surgery was ever performed.